Hello, Kent. Kidney Center, flagship of the Northwest Kidney Center. This is your medical director, Andy Brokenbrough, presenting you a virtual in-service and update on the COVID-19 pandemic. I think Angela suspects that I actually have the infection and therefore did not want to run the risk of aggregating her fine staff in the same room as me, which I'll admit is prudent. In advance, I'd like to thank my 11-year-old daughter Jeannie for her technical assistance with the recording and for reminding me that one advantage of a virtual presentation is that you cannot smell me because she thinks that I smell bad. Here are today's objectives. First, understand the current state of the pandemic. Second, we'll review different strategies employed around the world in an effort to maintain and slow the spread of infection. We'll look at predictions regarding the course of the pandemic, including a model recently published by the University of Washington. And finally, we'll discuss efforts at vaccine development. So, worldwide, according to the Johns Hopkins Coronavirus Resource Center, there are almost 800,000 documented cases. Undoubtedly, there are much more than this because testing has been limited for many reasons. In general, we don't test asymptomatic people or those with minimal symptoms, and testing supplies, including here in the United States, have been limited. The United States has the infamous distinction of having the greatest number of documented cases, but again, this does not necessarily mean that we have the greatest number of actual cases. Some countries, for example, have very limited capacity to test, or choose not to test people, or have defective testing, or choose to underreport the actual number of cases. Italy has a striking number of cases. There are 101,000 cases out of a population of about 60 million, or around 0.16% of the population. China has 82,000, but there is legitimate concern for underreporting. Spain has 88,000 cases, Germany 67,000 cases, France 45,000 cases, Iran 41,000 cases, United Kingdom 22,000 cases. And the Northwest Kidney Center, a population of about 1,600, has 16 cases, or 1%, which is significantly higher than any of the countries listed above. As of today, the total number of confirmed deaths around the world is almost 38,000. In the United States, there have been almost, I think it's 3,200 deaths, 150 of which are in King County. Italy has 11,000, Spain almost 8,000, China 3,200, but again, there's concern for underreporting. This graph shows the number of cases in the United States and 8 states with the greatest number of cases compared to Italy, one of the world's epicenters of the COVID-19 infection. The rate of increases in cases is greater in the United States, although our population is much larger. So you can see as the days progress, the number of cases rises, bringing us up to the present. Let's now review containment strategies. The main objective is to avoid overwhelming society with sick patients all at once. To that end, we want to slow the spread of disease to reduce the likelihood of crowding doctors' offices or exceeding the ability of hospitals to provide care. If you listen to the news, you may have heard that the goal of current interventions is to, quote, flatten the curve, end quote, of infection. The blue graph shows a large number of cases in a short period of time, which is what occurred in China and essentially overwhelmed their medical resources and likely contributed to a higher death rate than would have occurred if their hospitals had not been overwhelmed. The yellow curve represents a flattened curve or a slower rate of infection. That is, fewer people sick at one time, which is easier for a medical system to manage. So, how have we tried to flatten the curve in the United States? We have closed schools around the country because we know that children are vectors for germs of all sorts. My daughter Jeannie may think that I smell, but at least I'm not the same caliber of germ vector as she is. Currently, in 30 states, there is a mandatory stay-at-home quarantine, representing a total of about 75% of the population in the United States. Some are working at home while others are unable to do so. 23 states have shut down non-essential businesses, and we'll discuss that further momentarily. Many hospitals around the country have also canceled elective surgeries to allow for more resources and staff to be available to care for COVID-19 patients in the coming weeks. Travel has also been restricted. Northern and southern borders are closed to all non-essential travel. Flights from Europe have been banned, at least through mid-April, and the government has strongly discouraged discretionary travel, but not banned it altogether. Internationally, many countries have adopted similar measures. Germany, for example, has a stay-at-home policy, has closed schools and public venues such as museums and movie theaters. They have banned gatherings of more than 2 people. So clearly the German nephrologists will have to give online in-services as well. These represent the most drastic social restrictions in Germany since World War II. Similar measures are active in France, but in this country, in order to leave home, you need to fill out a form stating the purpose of each errand, and each trip requires a new form. In Italy, there is a near total lockdown on its citizens, although this restriction came after the virus was already widely disseminated in the community. Initially, Italy closed off the northern part, which led to a massive exodus of people to the southern part, inadvertently spreading the virus through the country. In Israel, borders are closed. The government is tracking the movements of all of its citizens. Tourism is shut down. All returning international travels are required to be in quarantine for 2 weeks. China is finally starting to relax restrictions on its citizens in the Hubei province. Previously, it forced all its citizens to remain inside for weeks. It mobilized over 20,000 medical staff from around the country to help deal with the Wuhan outbreak. And at its peak, 120 million school kids were taught online. Iran has closed schools and some, but initially not all, shrines. And this decision likely contributed to faster dissemination of the viruses through their country because there are, in some shrines, millions of pilgrims each year that travel there. India just engaged in a lockdown that affects its 1.3 billion population. The borders are closed to all travel. In the Philippines, about half the country is under quarantine and non-essential businesses are closed. Some countries adopted early quarantine and travel restrictions. Taiwan, for example, which still vividly remembers the SARS epidemic from 15 years ago, started screening passengers on airlines for fever as they entered the country in January. And they closed all travel between Taiwan and Wuhan on January 21st. All arrivals to the country are now strictly quarantined for 14 days. And under quarantine, their activity is closely monitored using cell phone data. To those in quarantine, they actually provide food, a stipend, care bags, small forms of entertainment to keep them comfortable. Interestingly, Taiwan does not engage in widespread testing. Singapore, another very small country, also banned flights from China early on, which is important because they were one of the first countries to report cases outside of China. They have banned travel. Their borders are closed. They've adopted strict punishment for those violating social distancing rules, such as 6 months in prison. And like Taiwan, they've actually been able to keep their schools open during the pandemic. Hong Kong, also an early adopter of quarantine. They early on restricted travel from China by suspending flights as well as high-speed rail since mid-January. And they also have adopted a strict 14-day quarantine for all returning residents. Okay, now, interestingly, not all countries have adopted such strict measures. For example, Sweden only shut its high schools and its colleges, but it kept its preschools, its grade schools, its pubs, restaurants, and borders open. People come there to ski. If you go into town, you see people eating in restaurants, you see kids playing in the parks together. Their state epidemiologist, Anders Tegnell, basically said this is not a disease that is going to go away in the short or the long term. We are not in the containment phase, we're in the mitigation phase. We're trying to slow the spread enough so that we can deal with the patients coming in. So their objective is the same as ours and everyone else's, but interestingly, they've not had any more cases than neighboring countries despite a much more relaxed control policy. As of today, the date of this recording, March 30th, Sweden has had about 4,000 cases, Norway has had 4,400, and Denmark has had 2,300 cases. So basically, time will sort out which strategy was most effective in managing the pandemic. So I mentioned earlier that many countries, including the United States, have made attempts at closing non-essential businesses. So what is an essential business? Essentially, it's universally accepted that institutions like hospitals and supermarkets and banks represent essential businesses. But beyond this, there is considerable geographic variation and definition of what's considered essential. So for example, in Washington State, liquor stores and marijuana stores are considered essential. In Arizona, golf courses are considered essential. In Connecticut, gun stores. In California, construction businesses. In New Hampshire, flower shops are considered essential because flower shops serve funeral homes and people die during this pandemic. In France, of course, pastry, wine, and cheese shops are considered essential. And in Great Britain, most restaurants are closed, but takeout fish and chips are still okay because how can the Brits survive without their fish and chips? Okay, so how long will all this last? No one knows how long the pandemic and its control measures will last, but several institutions have put forth models trying to answer this question. Last week, the University of Washington Institute for Health Metrics and Evaluation published a model on March 26th. And basically, they tried to take into account all of the social distancing measures which we've currently employed. They predict that by July 1st, there will have been 81,000 deaths in the United States. Recall that the current total is just a little over 3,000. So over the next few months, They predict that about 78,000 people will die. The peak of the infection will vary depending on the state, as you can see from the map. But basically, in Washington State, the expected peak is in the second to third week of April, so around April 21st. During the second week of April, hospitals and intensive care units are expected to start being overwhelmed by the number of patients with COVID infection. And at the peak of infection, it's expected that nearly 20,000 patients nationwide will need to be placed on machines called ventilators to help them breathe. Hospitalizations are expected to peak in mid-April with more than 64,000 patients needing hospitalization than there are currently beds available. And the shortfall in intensive care unit beds around the country is expected to be more than 17,000. Now, in Washington State, again, according to the University of Washington model, there is no predicted shortage of hospital beds, although statewide, the shortage in intensive care unit beds is expected to be about 100 by April 19th, so in a couple of weeks. The anticipated ventilator need in the state is 236, and it's not clear that we will have enough ventilators available to meet this need. This slide shows the expected number of deaths per day in Washington State, peaking at 27 on April 1st, and thereafter tapering over the next few months. Other groups have put forth models to answer the question of how long this pandemic will last. The Imperial College of London put forth a model on March 16th that predicts a much gloomier forecast, at least for the United States. They say that if no social interventions were taken, if life carried on as usual, that up to 2.2 million people in the United States would die as a result of infection. And 81% of the population would ultimately become infected with the COVID-19. That said, with the implementation of 3 months of social distancing measures, we could reduce the anticipated mortality to around 1.1 million Americans, or more than 10 times the predicted amount by the University of Washington model. Now, not everyone will die during an initial wave of infection. This model assumes that there will be a second wave of infection later this year. So most experts agree that there will be a second wave of COVID-19 infection at some point this year when the temperature drops. The same occurred, by the way, with the H1N1 infection. There was an initial peak in late June, early July, and a second peak in late October and early November. Many viruses spread more easily in cold weather, so it's possible that cases of coronavirus could taper off in the summer and then ramp up again in the fall. And just published was a Beijing study that reported their findings that the contagiousness of COVID-19 declines with increasing temperature and humidity. In addition to changes in weather, a second wave could occur with the resumption of usual activities, such as openings of schools, cessation of travel restrictions, or the use of mass transit. Again, opening up our borders and traveling could all contribute to a second wave. Hong Kong, for example, recently saw a second wave of infection. Initially, they implemented strict travel restrictions and everyone worked at home. And then on March 2nd, Hong Kong allowed its municipal employees to return to work. And the week that followed, there were only a few cases, but 2 weeks later, there were dozens of new cases confirmed. Most were brought in from overseas by travel, but then local transmission had resumed, and so once again they implemented fairly strict quarantine and travel restrictions to try to control this second wave of infection. And as of March 23rd, all civil servants are again working from home, and many private businesses are expected to do the same. Let's talk now about vaccine development. In general, all vaccines work according to the same basic principle. You expose the human immune system to part or all of a pathogen, like a virus or bacteria, and that prompts the immune system to produce antibodies to the pathogen. Antibodies are proteins that fight infection, and they can be quickly produced or mobilized, again, if you get exposed to the virus in its natural form. So the SARS-CoV-2 virus does not mutate significantly as it circulates through the human population. And this relative stability bodes well for the creation of an effective vaccine. So it's very likely that we'll be able to develop a vaccine within the next year and a half that will be effective against this virus. Vaccine development has been aided by two previous epidemics, the SARS, or the severe acute respiratory syndrome epidemic in China in 2002 to 2004, and then the MERS, or the Middle East Respiratory Syndrome, which started in Saudi Arabia in 2012. In both cases, companies around the world began working on vaccines, but then when the epidemics died down, they ceased work. There's a company in Maryland called Novavax, basically, which has repurposed vaccines for SARS-CoV-2 based on earlier research on the SARS and MERS viruses, also coronaviruses, and says basically they'll have several vaccines ready to enter human trials this spring. Moderna, a company based in Cambridge, Massachusetts, basically built on earlier MERS virus research to come up with a vaccine called mRNA-1273. Basically, this was developed in about 2 months under the direction of the NIH. And the first human trial was initiated here in Seattle at Kaiser Permanente. And more patients were enrolled yesterday, March 29th, in Emory in Atlanta. So in conclusion, the COVID-19 pandemic is expected to worsen in the coming weeks. The peak is anticipated in mid to late April. There's been significant societal effort around the world to slow the rate of infection, or so-called flatten the curve. And eventually a vaccine will be available and should be effective. Okay, it's quiz time. What is the goal of the current public intervention approach in the COVID-19 pandemic? So you go ahead and press your pause button and I'll give you the answer. Okay, so basically the objective is to reduce the rate of spread so that the medical care system does not become overwhelmed. Again, this refers to the term or the expression you may have heard of called flattening of the curve. Basically slow down the rate of curve development so that the number of people sick at one time is minimized and that a number that the healthcare system can handle. All right, this country has the greatest number of confirmed COVID-19 infections. And the answer is the United States of America. Okay, this country considers wine and cheese shops to be essential. Essential business cannot be closed during the pandemic. And you guessed it, France. What countries were early adopters of quarantine and travel restrictions that appear to have protected against widespread disease? Excellent. You guessed Taiwan, Hong Kong, and Singapore. You guys are doing great today. First coronavirus vaccine trial occurred in this city. Very good. You guessed Seattle. Okay. In conclusion, thank you very much for listening, and I'll leave you with this WiseP device. Remember not to touch your face. Thank you so much. Have a great day.